11 alarming signs that your blood sugar is dangerously high. Hello everyone. Do you find yourself feeling tired all the time, even after a full night's rest? Or maybe your vision blurs when trying to enjoy your favorite book or newspaper. These can be subtle signals that your blood sugar is higher than it should be. Elevated blood sugar is a silent troublemaker, sneaking up on us without dramatic symptoms but with the potential to cause serious health issues. It's a primary culprit behind diabetes, sure, but it can also increase your risk for heart disease, kidney damage, nerve problems, and even affect your mental health. So how do you spot the red flags? Today, we're going to explore 11 signs that might suggest your blood sugar levels are more foe than friend. Recognizing these could be pivotal in taking control of your health. Stay tuned because, beyond diabetes and the common concerns, we'll also shed light on a rare condition that might mislead those readings, a condition we'll reveal at the end of the video. Let's dive in and uncover the signs that your body might be sending you about your blood sugar. Number 1. Frequent urination. It may seem normal to need a bathroom break now and then, but if you're clocking in more bathroom time than a restroom attendant, it's not something to ignore. Health experts warn that while several factors can increase your need to pee, constant urination could be a sign that your blood sugar is on the high side. Here's what's happening under the hood. Your kidneys are the body's filtration system, sifting out waste and extra nutrients like sugar. When there's too much sugar in your blood, your kidneys go into overdrive trying to remove it. But if they can't keep up, they flush out this excess sugar through urine. As a side effect, you're visiting the bathroom more than usual. Number 2. Increased thirst. If you find yourself drinking water like a camel prepping for a desert trek, take note. It's not just the heat or your active lifestyle. Medical professionals point out that while thirst can be due to various reasons, an insatiable urge to guzzle down water can be linked to high blood sugar levels. So why does this happen? When your blood sugar is high, your kidneys are on a mission to filter that sugar out, which ends up in your urine. This sugar-pulling process also draws out the fluids from your tissues, making you feel like a well that's run dry. This is your body's attempt to balance things out, but it comes at a cost. You end up feeling thirsty all the time. Think of your body as a sponge that's full of water. Now, if that sponge keeps getting squeezed by your kidneys trying to get rid of sugar, it's going to need more water to fill it back up to its squishy state. That's your body asking for a refill. Number 3. Persistent dry mouth. Sometimes, having a dry mouth can just seem annoying, but don't brush it off too quickly. It can be a whisper from your body that something's not right. The American Dental Association points out that a lot of medications might dry you out, but if your mouth is often as dry as a desert, it's also a well-known sign of high blood sugar. When your blood sugar is too high, your kidneys have to work extra hard to filter and get rid of that sugar. If they can't keep up, the sugar spills into your urine, which pulls more fluid from your body, and that can make you dehydrated. And dehydration's number 1 sidekick? You guessed it, a dry mouth. So if you find yourself constantly searching for a glass of water, like you've just swallowed a spoonful of peanut butter on a hot day, listen up. That persistent dryness is more than just uncomfortable. It might be your body's subtle SOS about your blood sugar. Number 4. Fatigue. Ever feel like you're dragging through the day with a personal rain cloud overhead? If you're constantly tired, it's not just about poor sleep or a long day. You see, your body converts food into glucose, which your cells use for energy. However, when there's too much sugar floating in your bloodstream, because it's not being used efficiently, your cells don't get the energy they need. Imagine your body is a car. Glucose is your fuel, and insulin is the key that lets the fuel power the engine, which are your cells. When you have high blood sugar, it's like having a full tank of gas, but the key is broken. Your engine can't start, and you're not going anywhere. That's why you feel tired all the time, even if you haven't done much. Number 5. Blurry vision. Have you noticed that the world looks a bit like a smudged painting recently? If things aren't as sharp as they used to be, it's not just a sign to clean your glasses or rest your eyes. Eye care professionals point out that blurry vision can be one of the first warning signs of high blood sugar. Elevated blood sugar levels can cause the lens inside your eye to swell, affecting your ability to see. To break it down, excess sugar in your bloodstream pulls fluids from all sorts of tissues, including those in your eyes, and this can alter the lens's ability to focus, leading to temporary blurring of your vision. Imagine you're trying to take a picture with a camera, but the lens just won't focus no matter how much you twist it. It's not that the scenery isn't clear, it's that your camera, in this case, your eyes, has trouble adjusting. That's what happens when your blood sugar is high, except the blurry picture is your day-to-day life. Number 6. Sores that heal slowly. When a tiny cut turns into an epic saga of healing, it's not just bad luck. It could be your body whispering about a deeper issue. Healthcare professionals raise a red flag when wounds linger because slow healing can be a symptom of high blood sugar levels. Elevated glucose in your blood can lead to nerve damage and poor blood circulation. It hinders your blood vessels, which are vital for delivering nutrients and oxygen needed for healing. High sugar levels also impair the function of red and white blood cells, crucial for repair and defense against infection. If your skin seems to have forgotten how to patch itself up promptly and minor injuries are overstaying their welcome, it's not something to ignore. Number 7. Unexplained weight loss. Dropping pounds without a change in diet or exercise can sound like a windfall, but it may be an alarm bell instead. When your body can't utilize glucose properly due to insufficient insulin or insulin resistance, it begins to burn fat for fuel instead. This might sound beneficial, but it's an inefficient and potentially dangerous way for the body to produce energy. If you're losing weight even though you're not trying to, and especially if you're also experiencing other symptoms like fatigue or frequent urination, it's important not to take this lightly. This unintended weight loss might be your body's distress signal that something's off with your blood sugar. Number 8. Tingling or numbness. Have you ever experienced a mysterious tingling or numbness in your hands or feet, as if they were taking part in a ghostly play, feeling things that aren't there or not feeling when they should? This unnerving sensation is more than a peculiar quirk. It's a red flag that neurologists link to nerve damage, often due to high blood sugar levels, a condition known as diabetic neuropathy. Let's simplify it a bit. High blood sugar acts like a flood in the tiny life-giving vessels that supply your nerves. Begin with persistently high levels, and you start getting that pins and needles feeling, much like the prickling you get when your leg falls asleep. Ignore this, and you might as well be wading into deeper waters where numbness takes over and feeling starts to fade. Think of your nerves like the roots of a tree. Normally, they spread out, finely tuned to sense and respond to the environment. But when they're damaged, it's as though the ground has frozen around them. They lose their ability to send vital signals back to the brain, like a tree unable to sense the soil, slowly losing its grip on the earth. Number 9. Skin issues. Noticed any odd changes to your skin lately? Maybe it's become darker in some areas or there are rashes that weren't there before. These changes are more than just cosmetic concerns. Dermatologists point out that such skin conditions can often be the visible signs of something deeper going on with your health. When blood sugar levels stay elevated for an extended period, it can cause changes in blood flow and damage to small blood vessels. This disruption means your skin doesn't get the nourishment and protection it needs, leading to a variety of issues, from dark patches to rashes to infections. Number 10. Headaches. Ever have one of those headaches that just won't let up? It's easy to brush it off as stress or lack of sleep, but if these headaches keep coming back, they could be a signpost pointing toward high blood sugar levels. When your blood sugar is high, your body is in an osmotic imbalance, meaning there's too much sugar circulating in the blood and not enough in your cells where it's needed. This can lead to dehydration as your body tries to flush out the excess sugar, which in turn might trigger headaches. Number 11. Dental issues. Finding yourself with more cavities, or your gums aren't as healthy as they used to be? Don't just chalk it up to bad luck in the dental department. These dental woes could be whispering something about your blood sugar levels. Elevated blood sugar levels can lead to an increase in glucose in your saliva, creating a feast for the bacteria in your mouth. These bacteria produce acids that can lead to tooth decay and gum disease. Furthermore, high blood sugar can weaken white blood cells, which are the body's main defense against bacterial infections that can occur in the mouth. Having gone through these 11 signs, it's clear that high blood sugar levels can take many forms, often disguised as everyday annoyances. But there's something else I'd like you to be aware of, a condition that's rare but can significantly impact blood sugar levels and is often overlooked: celiac artery compression, also known as median arcuate ligament syndrome (MALS). As we've learned, the pancreas plays a pivotal role in regulating blood sugar by producing insulin. However, if the celiac artery, which supplies blood to the stomach, liver, gallbladder, and indeed the pancreas, is compressed, it can compromise blood flow. This, in turn, may impact the pancreas and its ability to regulate blood sugar, potentially mimicking or exacerbating diabetes symptoms. The relationship between celiac artery compression and changes in blood sugar is complex and not widely understood. It can often lead to a confusing clinical picture where the symptoms suggest diabetes, but the underlying issue may involve compromised blood supply to vital organs. That's why, if you're experiencing symptoms like these and aren't finding answers, it may be worth discussing the possibility of celiac artery compression with your healthcare provider. Remember, these signs are your body's way of signaling that something isn't right. Listen to them, and most importantly, take action. Consult with a healthcare professional to not only check your blood sugar levels, but also to consider other, less common conditions that might be at play. Enjoyed the content? Dive deeper into a world of health and wellness by exploring our other videos. Just click and continue your journey to a healthier, happier life.